Welcome everyone. My name is Michelle Meckelberg. I'm a member of the CASCMA, as well as a practicing veterinarian at the Edmonton Humane Society. And happy to have Dr. Scott Weese join us today. Many of us know Dr. Weese through his efforts at educating us on infectious disease through many of this talks like this and his Worms and Germs blog. So the topic today, as we all know, is the H5N1 virus, and we're looking at what this might mean for animal shelters in Canada. And so I will pass it over to Dr. Weese, but just before we'll mention that if you have questions, he's happy to answer them, and feel free just to pop them in the chat, and both he and I will keep an eye on it and see how many questions we can get to. So thanks so much, and welcome, Dr. Weese.
Great. Yeah, thanks a lot. Yeah, toss any questions in. I'm going to cover kind of fairly broadly flu. I think we have to understand some background to understand what the risks are and to be able to communicate with people. And with infectious diseases, the why is really important when we're trying to do things, having people understand the basis behind what we're doing. So I'm going to give a little bit of background information. I'm going to try to focus more on the things that directly apply to how we manage animals. It's more than kind of just shelter. This will drift a little bit more towards just the general animal health and management side, but the issues are basically the same. So just a little bit of background on flu. So influenza, it's widespread in the environment, or sorry, in wildlife. The natural reservoir is really wildlife, waterfowl, mainly in Asia, where there are all kinds of combinations of flu viruses out there. And they circulate around in wild birds, and they occasionally spill over into domestic birds, and then occasionally spill over into mammals. And the movement from, wild bird to domestic bird causes problems for poultry, and then the movement into mammals can cause significant problems for us. And when we start mixing flu viruses, we get particularly concerned because one strain can combine with another strain and change quite a bit, taking it from a purely waterfowl virus to something that could infect dogs or cats or people and potentially cause serious disease. And that's really what we're worried about here. So just basics. So we're talking about influenza. Really, we're talking about influenza A. That's one type of influenza. This is the type that's zoonotic, the type that's out there in wild birds and jumps into different species and is our human endemic seasonal flu. It's our canine flu, our equine flu. We've got a wide range of influenza viruses. You'll also hear HPIA, or highly pathogenic avian flu. This refers to what a virus does in poultry. So it's not really a makeup of the virus per se, it's how it behaves in a chicken. And some strains can go from a low pathogenicity strain to a high pathogenicity strain just through some changes that cause severe disease in poultry. Does not necessarily mean it causes more severe disease in mammals. Right. So it can be a bit of confusion. You can have highly pathogenic strains that really don't do anything in mammals, but some of them do. And then spillover is the big concern, and spillover is when we start moving into other species. So I'm not going to get into the virology of this, but influenza is a pretty basic virus. There are like 8 genes. H and N are the two that we talk about most because that's how we name them. So the number of H and the number of N, that's how we classify them. For example, H5N1. But there are other genes that can be swapped around and changed, and they're relevant for the virus too. So a little basic primer on where we stand kind of historically with flu, because it is kind of relevant when we're thinking about what could happen in the canine and the feline populations. So we do have a variety of canine influenza strains. These are flu viruses that are adapted to dogs. They're natural reservoirs, the dog, and they spread widely in the dogs. H3N2 is the main one in North America. That started off as a bird flu in Asia, spread to dogs, and then was imported into North America. We've had a couple introductions into Canada, but we've been able to get rid of it. So right now, this is kind of just an uncommon sporadic issue in the US, potential movement into Canada, but not something we're seeing as far as we know. H3N8 is an older canine flu, early 2000s, and it seems to be extinct. We haven't seen it in a couple of years. But there are some other canine flus that are out there, mainly in Asia, that we have kind of constant risk of introduction for. Dogs also can get human flu. So if you have influenza, H1N1 or whatever our normal seasonal strain, you can infect your dog. Usually it's just mild disease. And they can rarely, obviously, get spillover of avian flus. Cats, we don't have a feline influenza virus, a feline virus that circulates through the cat population, but they can get infected by us with our seasonal flu. They can get infected from other flus like endemic avian flus. There are other avian flus that are circulating in North America. They're just not highly pathogenic and they're not ones that are as concerning for spillover. But cats do periodically get infected with them. And one high profile one from a shelter component was an H5N1 outbreak in a shelter in the US that caused a lot of illness in cats and an infection in at least one person working with them. Okay, so on to the strain we're worried about today, and that's H5N1. So this is a highly pathogenic strain, first really identified as a problem in Asia around 1996. And it did what avian flus typically do. It was in the wild, it would occasionally move into poultry, cause these mass kills of poultry. There would be an aggressive response to eradicate it. There would be periodic spillovers into people, often fatal, but 30 to 50% fatality rate, but then it would disappear. So it would kind of come in, do its damage, and then move back out. In 2000, 2001, this changed. We started to see this global avian pandemic of H5N1 where it spread really widely and in a really sustained manner. We've never seen it do this before. And the scope of this, in terms of the geographic range, the number of species that have been infected, and the duration of this is really unprecedented. So this is more likely becoming an endemic virus. It's been a few years now, and it's still circulating widely in wild birds. We have to accept that this may become an endemic strain in wildlife, at least in a lot of areas, or at least for a long period of time. Now, whenever we've got a lot of virus circulating in birds, we get concerned about species that interact with birds, and particularly species that eat birds. So it wasn't too surprising when this started out and we saw more and more cases in birds to start seeing spillovers into mammals. Initially, those were species that would often catch and eat birds, foxes, for example. They were quite susceptible. You'd see litters of foxes that would be dead from H5N1. But this virus has a pretty impressive range. I think it's at least 48 different mammal species it's been found to affect so far, including some diverse species like sea lions in South America. There's been some widespread kills there. So there've been a pretty remarkable spread of this in terms of its range, its duration, and its host species. And just to show that a little bit, this shows where we've had major mortality events in wildlife. And you can see it's a lot. North America, South America, Europe, South Africa, Asia. This is a very widespread problem, which means it's probably not going to go away very quickly. Now to our situation. We started to see introductions of this in late 2021, probably. And this was one strain, and it doesn't really matter, 2344B. And this is a strain that's different than the main strains in Asia. And when it got here, it's had multiple introductions of different strains or different related strains. And there have also been some recombinations with our local flu strains that are circulating in birds. So we get a variety of different strains that are moving around. And these strains kind of evolve over time. So we can look at them. We have a couple of predominant lineages or subtypes that are causing problems right now in North America. And I'll mention a couple of those because there is some relevance in terms of disease. Canada, we've had in a lot of areas a fairly quiet last maybe 6 or 8 months. We didn't have as much of this as we would have thought in the migration season. We often think we're going to see a lot of this during migration when you get these birds mixing in flyways. And the fall wasn't that bad in most areas. But there's been a surprising number of cases in poultry in the winter, which would often be a quiet time. You can see it's not very, well distributed in Canada. This is just the last, 2 months or a little less than 2 months. But BC has been a hotbed. Ontario has had multiple farms that have been affected. So we still are seeing it, not to the degree they're seeing it in the US. And there are probably a few reasons for that, and climate is one that helps us out here. Just really quickly on strains, because this ties into some of the risk when we look at what's going on in the US, it gets quite relevant. As you probably have heard, this has become a problem in dairy cattle. So it was circulating in birds, and for some reason, cattle got infected. And the strain that got into cattle adapted to them, or it was well adapted before, but the net result is cattle are quite susceptible to it. They produce a lot of virus in milk. And when they produce it in milk, it's very easy to get cross-contamination on farms. So humans probably drive a lot of the transmission to cow through contaminated hands, equipment, and the like. and there've been a lot of cats that have died on farms. One of the markers of early influenza in cattle on a farm is the cats disappear or the cats start to die because they're quite susceptible and they get exposed to spilled milk, and they often get fatal disease. There've also been infections in people, and this has been the most common source of human infections in the US right now has been dairy exposure, I think, at this point. So this strain has been circulating in the US dairy population. We haven't found it in Canada. There's some surveillance of raw milk that's been done for a while and has not been found yet, which is good, because we don't move a lot of dairy cattle, at least lactating cattle from Canada or from the US to Canada, but there is ever-present risk of birds bringing it in. And this has been reinforced over the last couple of weeks by finding a different strain or different strains in dairy cattle in Nevada and Arizona. So infected cattle, not with this strain, with another strain from birds. So there is continued risk of spillover into cattle. So this starts getting us a little more aware of the risks to barn cats. They're coming into shelters. Maybe a month ago, we were saying, good news, we're not seeing this dairy strain in Canada. Yeah, there's always some risk of emergence, but maybe that was just a freak thing in the US. Now we've seen this freak thing happen a few times with separate introductions. So if it's happening in the US, we have to assume there's potential for this to emerge in dairy cattle here. And cats on dairy farms are going to be a group we want to pay attention to. So that's the B313 strain. And then there's D11. This is a new kid on the block, but it's a concerning one. It emerged in late 2024 and quickly became the predominant strain in wild birds. And that also means it's the predominant strain in poultry because poultry get infected from wild birds. This is the one that's caused those recent infections in dairy herds with different than the dairy strain in Nevada and Arizona. Has also caused feline infections, and it's been associated with some severe disease in people. We don't know whether this truly causes more severe disease or whether it's just, bad luck coincidence. But there's been one fatality and a couple other serious infections, and I'll get to that in a second. So we have concern about this because this has really emerged as a predominant strain. It spills over into different species, it's moved into cattle, and it does have the potential to cause severe disease in people. So why are we concerned about this? And I think this is important for us to think about. Why do we pay attention to this? So there are the human health aspects and the animal health aspects. And both of these really revolve around two main scenarios of this virus changing. If this virus never changed, it wouldn't be that big a deal for us. It's not very well adapted for mammals. It spills over occasionally. The number of people that have been infected is quite small. The number of cats have been infected is quite small. Dogs is really small. So right now, this strain isn't necessarily the thing we're worried about. We're worried about what it could become as it gets more and more adapted to mammals. And this can occur by what we call antigenic drift. And this is just gradual maturation, movement of the virus to become more amenable to infecting mammals. And every time the virus infects a mammal, there's that pressure for it to change or the opportunity for it to change to be better able to infect mammals. So the more that's out there in birds, the more it spills into mammals, the greater chance it has of staying in mammals and being passed mammal to mammal. The bigger concern is what we call antigenic shift. And this is how we make new pandemic viruses. When you have an individual that's infected with two different flu strains. So if we had a person that had H1N1 seasonal flu and they got H5N1 avian flu, and those two viruses had flu sex and made a new flu virus recombination, then we could have a strain that's able to infect people really efficiently, like our human flu, but we don't have immunity to it because we don't have vaccine protection or immunity from previous infections because it's closely related to that H5N1. And if it can cause severe disease, then we've got this combination of a highly transmissible virus where the population isn't protected from previous infection, where our vaccines don't work, and where it can cause severe disease. And that's a pandemic strain. And if we look at the 2009 pandemic H1N1 in people, that was this type of scenario. It was a combination of a human, an avian, and a swine flu virus. So the good things so far, there've been pretty limited human, and we can say animal infections, at least domestic dog cat infections, despite this virus circulating really, really wildly. It's not a mammalian virus very much at this point. Yes, the strain affects dairy cattle really effectively, so that's becoming a cow virus. But we don't have a lot of the markers that make it really able to nicely transmit person to person through respiratory secretions Infections have mainly been mild, and we've been encouraged by that up until maybe 6 months ago when we started to see more severe infections. And a big thing is there's little to no evidence of human-human infection transmission. So people get infected, but it's a dead end. If we start spreading it human to human, then things get much more concerning. But the more mammals that get infected, the greater chance we have of bad things happening. The more we have this influenza getting into the human population or people getting exposed while they've got human flu during flu season, it's a concern. And we really don't know what's going on in a lot of areas because we don't have great surveillance for influenza. So we don't know if it's really rare or we're just rarely diagnosing it. Human data in the US, they're at 68 cases, so they have a lot more than we do. Most of these are associated with farms. They're people that have been involved in handling or culling affected poultry or dairy farm workers. The true numbers can be much, much higher than that. They only test a small subset. And there's particular concern in US farms where a lot of undocumented workers, and they don't want to come under scrutiny. They don't want to get tested. They don't want the government paying attention to them. So we can assume the numbers are much, much higher, but most of those are probably mild cases. Uh, and there was that one death. So the serious disease I'll just touch on really quickly. That US death was a person in Louisiana, an older individual that had some other health issues. They were exposed to infected commercial poultry and infected backyard poultry, and they died. And they had the D11 genotype, that new kid on the block. There was one that was fairly high profile last fall, winter in British Columbia, an otherwise healthy 13-year-old that got very serious disease. And I'm talking extremely serious disease, incredibly intensive care required for this person. They also had the D11 genotype. Source wasn't identified, presumably linked to birds, but that wasn't identified. And for both of these, no human-human transmission, no infection identified amongst caregivers or family members. And in the US, there's also a person in Wyoming in hospital with, I believe, this strain they've confirmed now. So there are more serious infections coming up. Now, back to the animal side. Cats are very susceptible to this virus. Dogs are somewhat susceptible to this virus. There are a lot more reports of cats than dogs. And is that because cats are more susceptible or they're more likely to get exposed to wild birds? Maybe a little bit of both, but they probably are truly much more susceptible to infection and serious infection. So cats are the ones that we pay attention to the most, but we can't ignore dogs because they can get sick. What to look for? It's a bit of a challenge right now. We know what things can be flu, but we don't know the whole scope of that. And what I mean by that is we have lots of reports of very serious disease in cats. And classically, these cats have neurologic disease. They may not have respiratory disease, or it might be a milder component. So acute neurologic disease is really a hallmark of this infection. They probably can have solely respiratory disease. We don't know if they could have milder disease. And this is a really big question for us. And it's a huge issue for shelters because you need to know, are we only worried about flu in the cat that comes in? It's really sick and it's crashing and it's got neurologic disease or really severe respiratory disease. Or do we have to worry about it in every cat that's got flu-like illness or upper respiratory tract infection? And we don't know the latter very much, in part because we don't test a lot of cats. So a lot of these cats that have been diagnosed with flu have been barn cats, which you don't see until they're really sick, and you probably don't test them until they're dead. You've got a concern. We don't tend to see, as you know, as many cats in vet clinics. We don't tend to do diagnostic testing, upper respiratory panels for cats with typical respiratory tract disease, and not all the diagnostic labs can identify this virus. And it's improving, but especially months ago, even if a panel was sent off, a lot of the diagnostic labs would not look for this virus. So we don't actually know if there's a mild form of this disease that's overlooked or whether this, when it usually occurs, it occurs badly. Dogs, probably a fairly similar scenario, but much less common. There are few reported cases. Fatal infections have been identified, and I'll show one from Ontario shortly. Just to give you an example of some of the presentations, this is one of the earlier reports out of the US. Three cats, and the take home is neurologic disease. It can be a key part of this. The first cat had a variety of neurologic signs, had a fever, had increased respiratory rate. So it had a mix of respiratory and neurologic signs, with the neurologic signs being the most predominant. Next day, it started seizuring, and it was euthanized. The other cat, same residence as the first cat, a variety of neurologic signs. The strange thing here is this cat stabilized for 10 days and then crashed neurologically, which is weird for influenza. And I don't really know what to think about that, to be honest. And it raises concern that there may be cases that don't progress as rapidly as we kind of assume they're going to. So we have to keep our net fairly broad when we're thinking about H5N1. Third cat, outdoor cat, difficulty walking, lethargy, anorexia, nasal discharge, fever, and it was euthanized. Had some respiratory and some brain abnormalities. So this one was a little less overtly neurologic, but there still was some probably neurologic component for the difficulty walking more than it just being, weak and sick. So I think we need to flag neurologic disease in particular. Another example is from France, where there's a cat that lived next door to an infected duck breeding facility and had lethargy, fever, neuro and respiratory disease. I think this is really what we're thinking about right now is the main concern. The cat that's got risk of exposure and it's got a combination of neurologic and respiratory disease, fever, maybe some of those flu-like illness signs, and usually with a fairly rapid deterioration. This is the dog I mentioned before. This is a case from Ontario a little while ago, and this dog had been known to have contact with a goose. It was kind of gnawing on a dead goose, and that goose was tested and identified as positive. 3 days later, the dog had a fever, then it got diarrhea, respiratory distress, and it died. So this was a more classic severe respiratory disease, but the virus was detected in the brain as well. So I think this is not your typical kennel cough. This is a dog that went downhill really quickly and had really severe disease, but you don't necessarily know at the start. It starts off with a fever, develops some respiratory signs. So depending when you see them, they may not necessarily be screaming, I've got neurologic disease and I've got influenza. And I think for the shelter level and at the routine primary care level, this is the big question for us. Like, are these flu suspects, this cat that's got our typical upper respiratory infection or our kennel cough like dog? And I think we have to play the odds a little bit. If it's a young outdoor cat, it's got typical herpes-like signs, it probably doesn't have flu. If it's a dog that's been mixing and it's got typical upper respiratory signs, it's bright, alert, it probably doesn't have flu, but I don't think we can say 100% right now. And from a practical standpoint, I don't think we can flag everything with an upper respiratory sign as being influenza in terms of isolating them, testing them, PPE, everything like that. That's probably overkill. We just don't know how far to go towards that. So I think we need to think about the risk of exposure, the seriousness of disease, the progression of disease, and do we have other plausible explanations? Again, that common things occur commonly mantra. So understanding risk factors is really important. And we don't always know that, obviously, but we can think about a few things. So cats and to a degree dogs, outdoor exposure, contact with wild birds. Songbirds seem to be pretty low risk. They don't tend to be affected. Waterfowl are much more of a concern. Songbirds aren't zero risk, and where that comes into cats. If you've got a cat that's known to catch and eat birds, if it's just catching sparrows, it's probably not very high risk, but there is some risk there. So any bird catching cat certainly would have to be on the risk. Any cat that just gets outside, you never know what it's doing. It's going to be on the risk for exposure. Barn cats, farm cats. If you've got a cat that lives in a farm and they've got a poultry farm that's been affected, that's going to be really high risk. In the US, we would add dairy farms, and in Canada, we have to keep watching to see if we would add dairy farms. This would be a bigger concern because poultry farms tend to be pretty restricted in terms of their access, right? You don't have cats wandering around inside the barn with the birds, obviously. Dairy farms are much more open for animals like cats, and you've got barn cats. So there's a greater chance of exposure to a cat on a dairy farm than a poultry farm. Any unsupervised outdoor access, and this includes dogs too. If dogs that are running off in the bush, who knows what they're going to be eating, that would be a high risk. A lot of attention over the last few weeks about raw diets. So raw diets do pose a risk, predominantly poultry diets. And I'll come back to that. And in the US, raw milk. And there are a lot of reasons to avoid raw milk, and this is just one. So for raw diets, there have been multiple reports now of this in the US. And at least one included a high pressure pasteurized diet, which is a risk reduction method that theoretically should kill flu, but obviously doesn't all the time. In some ways, it's not surprising because they're raw, right? The reason we cook things is to kill things. But in some ways, it is surprising that it's hard to see how infected birds get into the food chain because, when you've got it on a poultry farm, it's usually pretty obvious. And those birds shouldn't be going for any type of food, right? They're not going for human consumption. They shouldn't be going for animal consumption, but we don't necessarily know where all companies source their diets. And if you have outdoor reared birds, outdoor raised duck, for example, you've got a greater risk of ongoing exposure and a greater risk of getting an animal that just got exposed and isn't sick yet, so it hasn't been flagged as a potential flu case. So poultry are the big concern. In the US, and if it ever moves here, beef, we have questions about because dairy cattle end up as beef at the end of their production cycle usually. But viremia, so the virus in circulation, is quite rare. It's really localized to the udder. And testing on experimentally infected animals has been pretty hard to find the virus in muscle samples. There's been a little bit of retail meat surveillance done in the US as well, and it hasn't been detected in beef. So I wouldn't say beef is no risk. I'd say beef is quite low risk. Poultry is the thing I'm worried about because it's much higher risk overall. Testing. So if you do have a flu suspect, obviously we'd like to get them tested. We want to make sure our test works. And this is a bit of a challenge because the diagnostic labs, they have to play catch up to figure out what they should be testing for. They have to validate their tests. And it's been a bit of a struggle to get clear information from the different diagnostic labs in Canada about what they can do. Um, some will test, some are working on it. Some have tests that are not really H5N1 specific that give us a reasonable idea. So if we're thinking about H5N1 and we're collecting samples, respiratory samples is what we want to get. Nasal swabs are probably a little better than pharyngeal throat swabs, but they can be very difficult to get, especially in a cat. So I'll take a good oropharyngeal swab over a nasal swab that's not very well collected, but it depends on the case. Sometimes we'll do a combination. We'll swab the throat and then rub it in front of the nose as much as we can. If they sneeze on it, then that's probably great. If it's a dog, good sized dog, it's much easier to get a good nasal swab. But a respiratory sample of some sort, if you are doing this part in the process, just use a normal culture swab, our normal bacterial culture swab. Don't use the wood tip, cotton tip, or wood handle cotton tip swabs. We want kind of a proper micro swab. So use that swab. Don't put it in the bacterial transport medium. Put it in a red top vacutainer. You can add a drop of saline just to keep things moist and then get it off to the lab. But really, a key thing is if you're worried about testing, talk to the lab, ask them specifically if they could test for H5N1. And if they can't, find a place that can. The animal health lab in Guelph is one place we know can do it. So university labs are going to typically be a little bit more into testing for H5N1 specifically. So talk to your lab. It's easier to use the lab you usually use, but if they can't routinely test, then go somewhere else. Just a really quick thing about testing. I know this may not be the thing for most people, but we want a test that detects H5N1. So if we just send a sample off and they do a PCR panel, there are different ways they'll do that. Some labs will do what they call a pan-influenza test or a matrix PCR. That detects any flu A. And that's pretty good, right? If it's flu A positive, we don't recognize circulation of H3N2 in dogs. Odds of a cat having some other flu are really, really low. Yes, it could be a spillover of a human flu, but it's it's very, very likely to be H5N1. Ideally, what they would do is send it off to a lab for confirmation, but it's a pretty good start. If they have an H5N1 specific test, that's ideal. If they're just running H3N2, H3N8, H7N2 specific flu tests, that's not good enough because those won't detect H5N1. They don't cross-react. So we need a pan-flu test that's followed up, or we want an H5N1 specific test. And again, talking to the lab is the best way to sort that out. Who pays for testing? So as you know, testing's expensive. And if you're trying to test every snotty-nosed cat that comes in, you're going to bankrupt your shelter pretty quickly. Typically, costs are borne by the clients, the owners, the shelter, whatever it might be. There are some surveillance programs going on. In Ontario, we do have one for feral cats. So we have the potential to do some testing on feral cats if there's a risk of exposure to cover the cost of testing. There are periodically surveillance programs going on in other areas that might be done by university researchers or done by the province. So you can ask around if anyone's willing to cover the testing. Otherwise, is user pay. The federal government doesn't cover routine testing of these. And again, if your questions, toss them in the chat and I'll back up, but I'll maybe pause in a minute for questions before we move on to some other things. Reportability. So this is a reportable disease. Technically at the suspicion level, vets are supposed to report it. Realistically, we report it once they're positive, unless we've got a really high suspicion. Diagnostic labs should report that directly, but we should talk to them too. And if we get a positive case in a shelter, there will probably be discussions on how to manage the shelter. And this is a challenge, and this brings in some logistical issues. At the start of this avian pandemic, we had a lot of issues trying to figure out what the response was going to be, because historically, this is a rare virus. It would come in and, you find it in a poultry flock, they would depopulate the poultry flock, and it would be done. The virus would be gone, right? Now, you can depopulate a flock, but that virus is not going anywhere. It's endemic in wild birds. So the depopulation discussion gets kind of complicated. For poultry, there's still an international expectation that poultry are depopulated. Poultry does include backyard chickens. So if you have a chicken in a shelter that's positive, or if you have a chicken in a shelter and you have a positive animal in the shelter, there would be discussions on depopulation of the chickens, not the whole shelter. And that's where infection control, I think, is really important, because if you say, okay, we've got a cat that's positive and we've got a chicken in the shelter, but there's no way that cat could have gotten exposed from this chicken, and we can isolate this chicken, I think we've got an argument that the chicken wasn't exposed and we don't depopulate. So this is a good reason just to have good infection control, really good documented practices, because if we do get a positive, CFIA is probably going to ask some questions about who's exposed, animals in general. And if you have birds, it comes up. And if you have chickens, it gets even higher in terms of concerns. So testing's expensive. So why would we do it, right? Part of it we want to know. We want to know what's going on. We want to know what the risks the shelters are. It's useful for you to know that a bunch of people tested a bunch of cats and no regular snotty-nosed cats had influenza. That's really good news to have, but we have to do testing to sort that out. But at the individual shelter level, there are some reasons to test. So there's the patient care. There is a potential role for antivirals with this disease in dogs and cats. And I'll come back to that. I'll try to be quick on that, but there is a role there for early treatment and maybe for post-exposure prophylaxis, which would be particularly relevant for shelters. Population exposure from the shelter level. If you have an infected cat, you want to know that as soon as possible so you can manage the rest of the population in terms of their isolation, in terms of documenting who's been exposed, maybe post-exposure prophylaxis, talking to personnel, figuring out what the risks might be. Facility infection control, the quicker we know, the quicker we can amp up our measures, right? Make sure we've got really good containment. And then the zoonotic risk. We don't know what that is. We don't know if cats can infect people. They probably can. It's a little bit of experimental study from quite a while ago with a different H5N1 where cats could spread it cat to cat. If they could spread it cat to cat, they could probably spread it cat to person. And the cats that are positive, some of these have PCR results that would suggest there's a pretty good amount of virus there. So my assumption is, or I think we should go on the assumption that cats are infectious. So anyone with direct contact or closed airspace exposure, but the cat is probably exposed. Okay, I'll maybe just pause here for a sec. I threw a lot of information, so before I get into treatment, I'll just see if there are any questions, and if not, I will jump into the treatment side. I'm not going to get too detailed in the treatment, but I do want to talk about antivirals because there are some issues to think about in terms of when we should and shouldn't use them, and there are some particularly relevant issues when it comes to populations like shelters. It looks like everyone's quiet. Hopefully someone's still there. So let's get into treatment. So I'm not getting into the basics. We treat sick animals like we treat sick animals. There are lots of things we need to do to support their health. And I'm not going to get into that. Isolation is really important. And I know isolation is a challenge in shelters because you don't have a lot of space sometimes, and you have a lot of animals that have plausible risks for infectious diseases. So we want to isolate as much as possible, but we particularly want to flag individuals that check boxes for flu. So that outdoor exposure, which is obviously a lot for your population, raw diet fed. So lifestyle and disease characteristics that would suggest flu might be present. We'll touch on that really quickly. But when it comes to antivirals, so this is an area where we don't use a lot of antivirals in veterinary medicine for things like this. We don't use a lot of systemic antivirals. In people, they'll use a variety of antivirals, and they're 4 FDA-approved antivirals right now for flu. I typically use them for people at risk of severe disease early in disease. So you've got someone that's been exposed or they've got early flu and they're at high risk of serious disease or death because of their age or immunosuppression or things like that. They'll pull out Tamiflu as the most common option. And there is some validity to thinking about that in animals. We know very little about the use of these drugs in dogs or cats, though. So if I was in person, I kind of ask you this question and see what people think. But just have you think about it yourself. Should we use Tamiflu, this important antiviral that's used in people with influenza, when we're maybe on the brink of a human pandemic with this virus? Should we be using it in dogs and cats? And I think the initial response would be, well, hell no, right? We don't want to burn that important drug. But I think there is a role for it here because we can do it responsibly and we can do it presumably very safely. And I'll explain why in a sec. So think about where we might use them. So severe H5N1 infection, probably not the greatest time to do it. So the cat comes in and it's got respiratory disease and it's seizuring. It's probably too little, too late. We've missed the boat on that early treatment. Early H5N1 infection that's currently mild. So the cat comes from an infected farm and hits the shelter and it's got a fever and it's got a bit of respiratory disease or it's a little bit weak and just doesn't really look right. That's a Tamiflu suspect. That's early disease. We might be able to stem this. And maybe high risk exposure. And this could be on a farm. This could be an animal that's eaten a recalled diet that we know is contaminated. It could be you have a couple cats in a room and one of them you found was positive and you've had close contact with them. So we've got a high risk exposure in a species where we know the risk of severe disease is really high. So, potential benefits are efficacy. We prevent serious disease. We have no idea how good this drug is for that. Costs, it's probably safe. We just don't know a lot about it, especially in cats. We have very little data about Tamiflu, about dosing, about safety. But I want to talk about the resistance concerns because that's the thing that people will ask about and the thing that we need to think about to be kind of prudent in how we use the drugs. And this is a different scenario than when we talk about antibiotics. So I spend a good chunk of my life talking about antibiotic stewardship, using antibiotics appropriately, not using them when we don't need to use them because we need to conserve them, right? And because we don't want to develop resistance. And same thing does apply to antivirals, but the issues are a bit different. So if we think about what has to happen for resistance to be a problem, so the animal has to be infected with influenza, any influenza, I guess. That virus has to mutate to become resistant. And then, this is the big one, that animal has to infect another individual. Because, random mutations to become antiviral resistant can happen. But if they die out with that cat because the cat dies or the cat recovers and doesn't affect someone else, it doesn't matter. It's a dead end situation. So if we think about some scenarios here, if we've got a situation where we're worried about infection, we're using it prophylactically. If I was using an antibiotic prophylactically, resistance is a concern because there are always bacteria in the animal. Doesn't matter if I'm treating that infection or not, there are always other bacteria that become resistant. If I've got a cat where I'm worried it's been exposed, and I say, okay, I'm going to try empirical Tamiflu. If it doesn't have influenza, resistance is not an issue because there's nothing that can become resistant. So we don't have to worry about that. Let's be really careful, make sure we're only using it in confirmed cases because we don't have the same degree of concern that we do with bacteria. And then the other aspect of it that's really important for us, from my standpoint, is we need to make sure they can't transmit it to another individual. So we don't even know if cats and dogs can infect other individuals, but we assume that they can. So if we're going to use these antivirals, we need to make sure we're doing things to prevent transmission. So I'm just going to give you a couple scenarios that kind of come down to my thinking, and this is the household context, but similar things would apply in shelters. So this is my combination of animals here. So top left is Alice. Alice was a completely wild feral cat, showed up pregnant, hung out in our garage. Eventually caught her, got her spayed. She started to hang out in the deck. She's a huge suck. And now, after a few years, she's just started to come into the house. In the last few months now, she's like a 90% indoor cat. She did a big switch, but she still goes outside because she's not fully adapted indoor life. So she is our risk. She goes outside, she can catch birds. If tomorrow she came in the house and was looking a little bit dumpy, maybe had some respiratory disease, maybe looked a little bit abnormal gait, something that flagged me she might have flu, I would most likely start her on Tamiflu right away. and I would test her because I want to know the risk to the population. Then we've got Milo on the right here, purely indoor cat. Um, he and Alice coexist. They don't spend a lot of time together. They share an airspace. They share a water bowl potentially. So there'd be some risk of exposure. If she comes in looking sick, I'm probably not going to treat him right away, but I'm going to see what's going on with her and I'm going to be testing her. And if she's positive, I'm probably going to treat him. So post-exposure prophylaxis. And she's going to be inside. If I decide to treat her, she's not going outside during her treatment period because I want to keep anything that might brew in the household in the household. Then we've got my pain in the ass 2.5-year-old lab Aussie down here. Lower risk species, he thinks the cats like him more than the cats actually like him. So they don't have that much time close together. I wouldn't do anything with him initially. I would watch him. If Alice is positive, still probably wouldn't give him prophylaxis because he's pretty low risk based on his species and he's an otherwise healthy young dog. The guy on the right, we don't have anymore. We had to euthanize him last year, but I'm going to use him as a good example anyway. So this is Merlin. He was about a 12-year-old dog at this point with chronic lymphoid leukemia, and he'd been on chlorambucil and prednisone for about 2 years. So he was an old dog, which increases his risk, and he was immunocompromised, which increases his risk. So if Alice is positive, I'd be leaning towards treating him prophylactically, just because if he gets infected, he's much more likely to die than Ozzy. So there are a lot of nuances we need to think about in terms of, but it comes down to what's their risk of exposure and what could potentially happen to them if they get exposed. And this is the same thing we would do in a shelter environment. So you have an animal that comes in and it's positive. Okay, who's they been exposed to? What are the susceptibility? What's the risk they really expose those animals? What's the susceptibility of them? How can we manage them? Can we actually treat them orally? And are we going to monitor? Are we going to test? Or are we going to use antiviral prophylaxis? So from my standpoint, it's use as little as possible, but use enough is one of my mantras for antibiotics, and that applies for antivirals. So don't use them unnecessarily, but I think when it's justifiable, it's justifiable. So prophylaxis is reasonable in high risk situations because of the reasons I said before. Treatment is best early in disease. So early recognition, early testing is important. And if we have a single case in a shelter, we want to pay really close attention to everyone else for isolation purposes and for treatment purposes. In terms of dosing, won't really get into that. I'm 2 plus milligram per kilogram twice a day, liberally rounded up. For cat, there's a suspension you can get as well, so it's easier to treat cats, but it's not that hard of a drug to give. We just have to realize we have basically no data on how to use the drug. So it's my take home again for a couple of things is proper administration must be possible. And this is relevant for shelters. This is relevant for animals going into foster or animals in households. If we can't treat the cat in particular consistently, I'm not going to treat it. If they can't treat it twice a day because it's fractious and they can't figure out how to do it or they can't get help doing it, then I don't want to treat that cat. If they're going to let it go outside, I'm not going to treat that cat because I can't guarantee they're going to treat it twice a day. And I don't want it taking a viral resistant strain, antiviral resistant strain outside. So I've got to be able to treat the animal and I've got to be able to isolate them. And that doesn't mean, locking them away and never seeing them in the bathroom of a household, but it means keeping them contained, not letting them outside, keeping them away from other animals and restricting the contact with people as much as we can. Same thing in a shelter. So if you got an animal that we just can't treat, you don't have the people that can do it, it's too fractious to treat. If you can't isolate it, you just don't have any isolation capacity and you're just letting things mix around, it's not going to be a situation where I'd want to use Tamiflu. And we'll just skip to kind of the bottom ones. This relates a little bit more. Community cats and colony cats would check some of those bad boxes as well. I wouldn't want to treat a colony cat because I might create antiviral resistance in the population. The last thing I want to see is develop a Tamiflu resistant strain in a cat that's outside, and that cat then tangles with a bird and the bird gets away, which does happen, right? And the worst case scenario for that is we get Tamiflu resistance developing in the cat and affects the bird. Now we've got a Tamiflu resistant strain circulating in birds. Yeah. Unlikely, for sure, but not something that's worth trying. So I would be very hesitant to be using this in outdoor community cats, especially in colonies. Okay, back to raw diets. US FDA just recently came out with some instructions to manufacturers because they've had the issues in the US with some infected cats. And basically what this says is you have to think about flu. doesn't say to do anything. It says you have to make a plan, which probably means the good companies are already doing it. They already have a plan. The crappy companies are saying, yeah, my plan is we'll see what happens. So it didn't actually change things, but it did raise some awareness, hopefully, about the need for it. Okay, so prevention of exposure. This isn't something we're going to see much of in shelters, I would assume, in terms of raw diets, but just don't feed them. That's the ultimate prevention tool. You don't get flu from a raw diet if you don't feed a raw diet. I'm not naive enough to think everyone will listen to me on that. So if people are going to feed a raw diet, the key take homes for me are avoid high risk meat sources. So avoid poultry, especially duck, outdoor reared duck, and use high pressure pasteurization. It's not a risk elimination tool, it's a risk reduction tool, but it should reduce the risk quite a bit. It should drop viral loads. If it's a proper technique in particular, the diet should be quite low risk, but we know they're not no risk. Now, I've touched on this a few times. Are infected dogs and cats infectious? Are they contagious? And the answer is we don't know. And the other answer is probably. At least we have to go on the assumption that they are. So if you have an infected animal or a high risk case that you're worried about in a facility, we want to treat them as infectious. We want to treat them as infectious through respiratory secretions and through direct contact. A couple other odds and ends, and I'm going to cover some infection control stuff, and I'll try to get to some questions shortly. So, vaccination. We don't have canine flu vaccines that cover for this virus. So, H3N2, H3N8 vaccines will not provide protection against H5N1. And that's what's in the current canine viruses or vaccines. We don't have any flu vaccines for cats. Poultry, there is a vaccine available, but there are regulatory challenges. The US just gave conditional approval to a poultry vaccine. There are a lot of barriers for trade, which are kind of holding people back. Just yesterday in Canada, there's an announcement that Canada's purchased 500,000 doses of H5N1 vaccine. Not really clear how it's going to be used, but it's there for contingency purposes. Our seasonal flu vaccines won't do much. There might be a bit of protection from the H5N1 component, or sorry, H1N1. H1N1 is one of the viruses in our seasonal flu vaccines, and the N1 is kind of similar to the N1 in H5N1, but it's assumed there's very little protection and maybe no protection. So we don't have population protection from this. And like I said, we got a bunch of doses now in Canada. So for infection control, a couple things to do. Identify suspects as soon as possible, right? The quicker we know, the quicker we can take measures. And that's identifying ones that are high risk based on their situation or high risk based on their disease. And in general, it's a much better idea to be aggressive at the start. We'd rather over-identify cases and then de-escalate. So I'm not sure, I'm worried, let's put them in isolation. And then once we get a little more information, we can spring them out of isolation as opposed to let's toss them in this, group room and then say, oh crap, the next day, this cat probably had flu. So identifying of suspects as soon as possible, isolating them, which is always a challenge, PPE that I'll come to, and then cleaning disinfection, which is actually really easy because this virus is easy to kill. So admission screening, I've gone over this a bunch of times already. Outdoor access, bird exposure, from dogs, exposure to waterfowl would be the big risk, especially if there's known activity in the area. So if you know there have been a bunch of dead geese or ducks in an area and a dog was found in that area, that's a high risk case. Even though dogs are pretty uncommonly affected, that's a high risk exposure. Raw poultry exposure, raw milk in the US, or if it hits here, just general poultry exposure, especially farms, obviously, where there's known infection. Maybe contact with a person with high risk exposure. And this could be from direct contact, the person's sick, or this could be from their clothing. And there's been a couple situations in the US where we're just starting to get some data out, and there's just some released today that I haven't read fully, where it's suspected that owners might have infected cats through bringing the virus home on their clothing from farms. So there are a variety of indirect ways. So if an animal has exposure to someone that's working with infected farms, that's a risk factor there. And then the disease components that I talked about before. Isolation, obviously dedicated space, ideally negative pressure, but we know we don't have that. At least understand your airflow so your isolation doesn't flow air right into your adoption room. And you may say that sounds pretty straightforward, but you'd be surprised at how often that happens. So know where your airflow goes. It probably isn't going to spread really effectively through ducts in the shelter, air ducts, but we'd rather prevent that. maximize ventilation, maximize fresh air that goes into an isolation and that gets discharged. Portable HEPA filters, like this one on the right here, these are really useful. They're pretty cheap, like $200 gets you a pretty good quality portable HEPA filter. You can toss it in isolation all the time, or you can toss it in a room where you're concerned about flu. It's going to help reduce the air burden. We don't know how much it can be in the air, but if you have an animal that might be infected, you can toss this in front of the cage. They're not very loud or disruptive. It can't hurt, right? There's not a lot of contraindication to it, just a little bit of upfront cost. Minimize entry, keep the door closed, and make sure people wear PPE for any entry. And that sounds very straightforward, but you'd be amazed how often people don't do that, right? They say, oh, I just need to go in and check something or grab something. So I'm not going to put my PPE on. But then they go in there and they see something they need to do, and my water bowl's flipped over. So I'm just going to toss a water bowl in there. And then 10 minutes later, they've been hanging out with the cat that's infected without PPE, without really realizing what they've done. In terms of what PPE to wear, this is what the CDC says, and I'm going to lay it out because this is what the CDC says, and it's really based on poultry, those types of situations. So they get into the normal gown, respirator, eye protection, but also into hair covers, boots, suits, essentially, which is more than we probably need in most situations. From my standpoint, I want something that's covering my clothing that I might contaminate with my hands, or if I'm holding the animal against myself, I want to protect that. If you've got long hair, you want that up so it's not falling on the cat if you're working on it. I want a good quality mask, ideally an N95 that's properly fitting, and eye protection. And we do a very crappy job of using eye protection around domestic animals in general. So safety goggles or a face shield. We want, anytime we're worried about something coming from an animal's respiratory tract to ours, we should protect our eyes, not just our mouth. And gloves, and wash your hands after taking gloves off. So pretty straightforward. We're worried about getting it from respiratory secretions and from direct contact with the animal. Those are the big concerns. If you've got a dog that might be infected and it's in a run and you're walking into that run, sure, boot covers would make sense because you're walking in that area where there might be flu. If it's a cat in a cage in a room, I think boot covers are probably pretty low risk. Now, I'll skip that. One last thing, cleaning and disinfection, like I said, is pretty straightforward. The biggest barrier to cleaning and disinfection is actually doing it. Influenza viruses are really susceptible to disinfectants, basically to all our routine disinfectants. So if you're using a good quality shelter disinfectant, that will kill flu as long as it contacts it. So we just need to make sure that the cleaning step is there to remove the debris and that things actually get disinfected. If you hit them with this disinfected, you should be good. So with that, I'm just going to check on the questions. If you have more questions, feel free to toss them in. We've got a couple minutes there. Can you test domestic animals post-mortem? Absolutely. Yep. You can do respiratory samples or you can do brain. And if it's an animal that's got neurologic disease and it's had human exposure, if it's getting tested for rabies, that's an opportunity to grab a sample if they're taking it. But often, in a lot of places in Canada, they're doing testing secondarily now, opportunistic testing. So if a cat is being submitted for rabies testing, they'll also test it for flu. But in terms of what you can do, if the animal is dead, you can do something as simple as stick a swab in its mouth and up its nose. If a necropsy is being done, you can sample the lung. And if they're opening the brain, you can sample the brain. I'll check that link in a minute, see what that is. Yeah, TNR program. So anytime we start to get more contact with, wild animals and feral animals, we start increasing the risk. Inherently, that's going to be an issue there. So I think there are a couple aspects when we're talking about TNR and colony animals. One, I think just in terms of the management of the colony animals is observation of them. Like we want to know if there are sick cats and dying cats more than normal, right? Sometimes cats die in these groups, obviously, but I want to know sudden deaths of otherwise healthy cats. I want to know multiple deaths, and I want to get those tested. And that's where, in Ontario, you could call us. We could probably get testing done. And other places you might be able to get that done because those are going to be sentinels for exposure. In terms of interacting with them, it's a little different than the situation in COVID. Remember in COVID, we were really trying to cut down the interaction of us with community cats and in groups because we're worried about us infecting them. This is kind of the opposite dynamic. We're not going to give them avian flu because we're not the likely source. having people just kind of up their general infection control game is a good idea. Like I don't think we need to say people should go in anytime there's an outdoor cat, they should use a mask and eye protection and gown and all that stuff. That's overkill. But if you've got some animals that have been dying, or animals that are sick in the group, you might want to reduce the contact, or you might want to do that type of increased respiratory precautions. A lot of it, I think, is just good communication with the caregivers to identify problems and be proactive. And again, if you're in my area, call me and we would figure out what's going on, whether I need to get out and sample or whether we need to see what's happening. Um, the question from the audience is sent deceased geese to CWHC that tested positive. Are you required to report that? So that will be reported through the lab. So we're required to report domestic animals, and really the reporting gets done through the labs anyway, but we wouldn't have to report that positive goose. How stable is the virus on surfaces? Not very. Any virus inside where it's nice climate controlled, there's no UV light, it'll stay there for a while. Flu, maybe a couple days could stay there. It shouldn't last very long. It'll last for seconds if you hit it with a disinfectant. So in general, time isn't what we rely on for disinfection because even your really wimpy viruses maybe can survive for a while, especially if you've got a bit of mucus or something there. It's a nice protective environment. It's not like parvo that can stay in the environment for months or years and survive disinfectants, though. Some staff members have asked if freezing raw will help kill a virus, and no. Viruses don't mind being frozen. They don't really like freeze-thaw cycles, so a bunch of times freezing and thawing isn't really great for them. But, how do we save viruses for long-term storage? We freeze them. We freeze them at really low temperatures. So freezing is not an elimination tool. Freeze drying isn't either. Freeze drying is also a great way to preserve bacteria and viruses. So the only way to eliminate the risk from a raw diet is to cook it. To reduce the risk would be high pressure pasteurization. To recommend incoming quarantine for birds before they go to the general population. I think that's a good general rule. It depends on the species. If it's a species that we know is high risk, then for sure. If it's a water bird, if for any reason, if you got ducks, geese, anything like that, you got wildlife that are coming in, then absolutely I'd want them. If it's, an indoor surrendered whatever cockatiel, the risk of that from that animal is going to be exceptionally low. So again, it's kind of like cats. I'm worried about the potential for exposure. If they've got outdoor exposure, then I'm starting to pay attention. If they're a highly susceptible species like waterfowl, then I absolutely would want to pay attention and isolate them. If they're a lower risk species, then sometimes practicality comes into play. So I would rather isolate more than less, but if you've got kind of a low risk wild species and you have limited isolation capacity, you're probably better off saving that capacity for waterfowl if that's what you see. Plan for vaccinating poultry in the US. Yeah, it'd be interesting. So poultry vaccines work, but they're a flu vaccine. And you all know flu vaccines aren't great vaccines. They're largely there to reduce the severity of disease. They make probably the most sense in situations where you've got outdoor exposure and you've got groups of animals that aren't going to be depopulated. The question with poultry is, will it actually have a big impact on farms? So, if flu gets onto a farm and the farm's vaccinated and only 5% of the birds die, that's good. But if they just say, okay, well, we're going to kill them all anyway because there's flu in this barn, does that actually help us? So will it provide enough protection to prevent the virus from getting established when it sneaks in on a wild bird? We don't really know. The outdoor reared poultry, it definitely is a role there. And in Europe, that's where it's largely been used, especially outdoor reared geese and ducks, so highly susceptible species where you've got this rolling risk of transmission and you don't have that all in, all out cycle and that same type of management process. So it will be interesting to see. Like, it's not going to hurt by any means. Will it actually have a big impact? I don't know. Vaccination of cattle would make a lot more sense because cattle don't die with this typically. Some will, but they don't have the same mortality rate. We don't cull them. We have a lot of contact with them more than we would domestic poultry. So actually, a cattle vaccine would be much better for human and animal health. And cats, I would assume farm is looking at a feline vaccine because if this becomes an endemic virus and it starts killing more cats, I think there will be a demand for it. So that was more than just what I think about vaccinating poultry question, but I think it'll be interesting to see. Um, The USA continue H1N1 surveillance. Yes, hard to say what the USA will do. The US actually has a very good milk testing strategy right now. As long as they don't shut that down, they have a national program where they're testing. And the main weakness there is the number two and the number three states, Wisconsin and Idaho, aren't doing any. So California is the top state. They're in that. That's where we know the most. The US is very state driven. So states that are motivated are doing, I still think, good surveillance. I think right now getting anything extra done is going to be a challenge with the way it is in the US right now, though. Questions about risk to coyotes and canids after eating, consuming, yeah, sickies. It's certainly a concern. So if you've got a dead goose out there and you've got a coyote eating on it, that's a higher risk situation. We do know that dogs have gotten influenza that way. What are we going to do about it? Like, we're not going to catch the coyote and give it Tamiflu, right? I think it's just a matter of increased awareness. I guess there's only so much you can do when you've got a natural cycle of, a scavenger eating a dead animal that's infected. Um, do we know much about susceptibility of coyotes? Not all. Foxes are definitely susceptible. And I guess let's do that second part of the question. I haven't seen as many reports of coyotes as foxes. So there probably is a species susceptibility there. So a fox scavenging a goose is probably a greater risk than a coyote scavenging a goose. I don't think we're really going to sort that out until we see more time and see what happens, because I don't think people will be experimentally infecting them, but it's definitely a risk. And from a dog standpoint, if we had a dog that was scavenging a goose, what I want to do is test that goose. If the goose is positive, well, if the goose is negative, then I can relax. If the goose is positive, then I want to watch that dog really closely. I want to keep it isolated, and I would probably jump on Tamiflu really quickly if that dog started to show any signs of disease. Can a mammal test positive simply from consuming a carcass without having the illness? Probably not. It's a great question, and we don't have a solid answer for that. The virus will get inactivated pretty readily going through the stomach and the acid, and RNA doesn't survive very well. We can pick up things on PCR that are just transiently passing through. We see that with parasites, right? We see eggs that are just coming through with something in the environment. Less likely to happen with influenza, I would think. I don't know of anyone that's actually tested that, but I would say it's probably fairly low likelihood. Why do you think we've seen more spillovers into cows? Yeah, great question. I have no idea. And why is it more in the US? Is it critical mass? US has much bigger dairy herds than we do in Canada. So if you got 1,000 cattle and all it takes is one to get infected, it's going to happen more commonly than if you have 50 cattle farms. Um, there's more of a seasonal effect in Canada potentially too. So I don't know why we haven't seen more. And has there been more that we just haven't recognized as well? So if you look at the two most recent farms with the D11 spillover, they were picked up through active surveillance, right? So they found the virus and they went looking to figure out what's going on. They weren't picked up because these cows were sick and people were testing sick cows. And it might be the cows were going to be tested eventually, but are we missing them because they don't always get severe disease? And if they get spillovers of different strains than B313, do they maybe get less pronounced disease? So we're getting spillovers that kind of go in and disappear. I don't really know. I think we'll need to see it. If we go another couple of years seeing those spillovers in Canada, but seeing them in the US, then it'd be interesting to figure out why. And it may come down to the bird species that are the bridge. And maybe we don't have those bird species up here or don't have the same infections in them. But yeah, there are a lot of great questions that, we'll have to see over time, I think. Um, if I'm out of time, just jump in and tell me to shut up. So, the potential for animal protection act seizures on species like waterfowl or chickens, how do you manage those? So, I would isolate them as much as possible. And it really depends on your shelter. One of the questions I think you should ask yourself is if CFIA came in and said, we want to kill every bird in this facility because you have a positive bird, would you be able to make the argument that this infected chicken would not have infected the cockatiels based on where they are, based on your practices? Now, I don't think there's as much of a concern about depopulation now as there was a few years ago because they really are bringing it back towards poultry, and it's because of the international obligations to depopulate poultry. So we dealt with this with rescues a few years ago where they're really concerned because if we found it, they want to kill all the eagles and everything, these high value species. And it was a bit unclear what the response would be. Now there's a lot more consideration of the value of the animal in terms of conservation, human animal bond, things like that. So there's less of a risk to the shelter from the non-poultry species. Still, there's always some risk and you're maybe at the mercy of whoever comes in. So perfect scenario is they're isolated in a trailer, when it's better weather, they're somewhere secure outside the building, or they're a foster or something like that, so they just don't come in the building at all. If they're in the building, then I want to make sure I've got as much physical separation as possible. So when we talk about isolation, we talk about physical and procedural separation. And physical separation is always better because you don't breach it, right? If they're not in the same area, they're not in the same area. Procedural separation, so infection control practices, it's harder to prove that you're doing them and they're more easy to break. So as much physical separation as possible if they're in the shelter, and then document your practices. So you can say to someone, we're really confident there's no exposure.
We might stop it there just
Yep.
to respect time. I thank everyone for joining. I know this is a really hot topic. And again, want to acknowledge, Scott, that you do an excellent job of sort of making a really complex subject palatable and understandable. So thank you very much for that. And we'll catch everyone at the next webinar. Hope everyone has a great day. Thanks again, Scott.
Great. Thanks. Have a good day.
Bye.